Hi, this is Dr. Martina, your online sex therapist. Physical pain and sexual desire is the topic of this week. When we go through our life with these wonderfully designed bodies that we have, we get hurt, the body gets hurt, and we feel pain. And pretty sure it doesn't matter what kind of pain, if it's a tiny little owie or if it's a broken bone or something like that, pretty much all of us can relate to physical pain. And what most women can relate to, that our sexual desire goes out the window when we have physical pain. You know, I don't mean just, this is not the one where we say, you know, honey, not tonight, I have a headache. That is most of the time some other story. But it's just when we don't feel sexy and we just cannot even imagine being sexually active. Now, the funny thing is that it's exactly during that time when your body is healing from some kind of a trauma that it could use a sexual release. And I'm going to tell you why that is and how you can overcome that lack of desire and give your body a chance to heal. I want to give you a little personal story about how I overcame the lack of desire when I was feeling physical pain and really recognized and learned how much sexual release helps the healing process. 9 years ago, I had abdominal surgery. They had to cut through my stomach muscle this way, so they told me I was going to be lying up for quite a while with some moderate to high pain level, which is what happened. And after 2 to 3 weeks lying on the couch, I was going stir crazy. I really wanted to have something else than having the high muscle tension that I felt. Because what we do is with our bodies, when, you know, we don't like pain. I mean, we're afraid of it, we don't want it, so what we do is we hang on to it with our muscles. We're afraid to move. I was definitely afraid to move, and because the second I did, you know, there's a spike of pain coming in. So I was getting tired. I was physically tired, even so I was just lying there. And I said to myself, okay, I just want to be serviced. I want my lover to come over and just take care of me, and I want to experience an orgasm. And so I can let go of that high muscle tension. And I could possibly produce a better blood flow, because of course when you have high muscle tension, you know, you mostly diminish your blood flow. And then the body can't heal, or it will be delayed, it will be slowed down in its healing process. So I called a lover and I gave exact instructions, which is what's required, because I needed to be able to say, okay, I'm not going to be able to do anything for you, I won't do anything for you because I just can't, but I really would like to have an orgasm. I don't know how it's going to feel, so, you know, oral stimulation I think would be the best. So basically I'm asking you to do 68, which is you do me and I owe you one. So that's exactly what I did. And that's exactly what happened. While the stimulation started to come in, I had to really give instructions, because I had to ask the lover to stop, come back again and stop, because, you know, I was quite sensitive. And then I used my breathing technique, which is what I talked about in other videos. That's really important, and the breathing technique helped me to calm down. It also helped me to let go of my muscle tension. It helped me to get the blood flowing in the right places, and I didn't have to move at all. I just very slowly, my arousal increased and went to the level of the point of no return, and then I let it go really slowly. So it was a nice slow curve. It wasn't a spike, because I couldn't be jumping up and down and engage all my muscles to do it. I had to just stay with the breath and the stimulation. And after the orgasm, I was able to lie there and my whole body was resting and was at peace. And I remember crying because I let go of so much tension that I was hanging on to while I've been on this couch for weeks. So orgasm, sexual releases help your body when you're in pain. And I remembered this because 10 days ago I twisted my ankle. I did quite a number on it. I've been in a lot of pain. And just today I decided, okay, don't, remember, yeah, I don't feel sexual, yes, but remember what a sexual release does, and remember that time 9 years ago, and you've done it since, so why don't you just get over it and do something that you don't feel like doing, because afterwards you're going to feel great, just like cleaning the house. So I did. I put my foot up and I started very slowly, and just in the beginning, even when I slowly touched myself, there was compassion coming in, because that slow touch felt so good, and I was doing something for my body and not just focusing on the pain of my foot, and being mad at myself for falling the way I did. So it was a slow curve yet again, with a slow release, and afterwards I could feel, because I did get my heart rate up, I could feel the blood flowing towards my foot. There was a crippling going on, and I just kept looking at it, and I kept breathing with it, and I had compassion for it, I had peace with it, and I could feel it, the foot just going, saying thank you, thank you. So if you feel physical pain, if you don't have a lover, if you do have a lover, instructions are important, but have your body be serviced so you too can let go of the muscle tension. You can focus on pleasure instead of pain for a short while, and let the body, give the body its optimal chance to have blood flow to the area where your injury is. It works, and it is something your body will be so grateful if you get to do that with it. So I encourage you, if you're afraid, if you want to talk to me about it before you do it, please reach out. I'm here to help. I'll talk to you next week. Bye. And by the way, my foot feels much better.